Today I'm going to tell you about a doctor's wife who came here. When she walked in the door, she walked like this. Her fingers were curled. She was looking out of the top of her eye, just like that. Her husband was a doctor and couldn't fix this problem. Her with one treatment of ultraviolet blood irradiation, and we're going to talk about that today. This is the machine that cured the doctor's wife. As complicated as it looks, it's not. Inside this machine is nothing but an ultraviolet light bulb. And what we do is we take a syringe connected to tubing, to IV tubing, which has a quartz glass rod in it. The quartz glass rod goes in this lamp. That's basically what it is, a lamp. And what we do is we have the patient sit here in this chair. The needle goes into the patient's vein, and I turn on the light, turn it on 2 steps, and I pull back on the syringe, slowly drawing the blood out of her arm through the light and into the syringe. When the syringe is filled with irradiated blood from the light, I slowly push it back in the opposite direction. It gets irradiated with ultraviolet a second time, and it goes back into the patient's body. I do that 3 or 4 syringefuls, depending upon the patient's weight. And that's it. The needle is removed and the patient goes home. The information that I'm about to give you is not from me in actuality. It's from a book called Into the Light by William Campbell Douglas, MD, and by Dr. Miley's Ultraviolet Blood Irradiation, a history and guide to clinical applications, and yet a third book called Healing Photons by K.J. Dillon. I've gleaned this pamphlet from those books. First, instructions to the doctor on who he should not do ultraviolet blood treatments on. The answer is people with small veins and people with hemophilia and acute hemorrhagic disorders. How many treatments would a patient require? Frankly, it varies with a different diagnosis, but it rarely involves more than 1 treatment in an entire week. American clinical studies has shown that ultraviolet is useful in asthma, viral illnesses, viral hepatitis, useful in bacterial infections, diabetic gangrene, acute and chronic inflammations, bursitis, psoriasis, and skin disorders. It's useful in trauma, in getting things to heal. It's useful in viral pneumonia. I've used it many times for that. It's useful in rheumatic fever and rheumatic heart disease. Now, German studies shows that it's useful in artery occlusions, in strokes, in ulcers of the legs. It's useful in Raynaud's disease, liver diseases, liver inflammation, thrombosis, clots, increased blood coagulability. It's helpful in people who have migraines, acne, herpes zoster, that's shingles, and psoriasis. Keloids, after surgery, when you heal poorly with those raised or widened scars. It's useful in eye diseases, including retinopathy, diabetic macular degeneration, retinitis pigmentosa, uveitis, and chorioretinopathy. I told you this would be a horrible list. It's useful in pre- and post-operative management. Stimulates the body's forces in fighting germs and in healing things. It's been of use in multiple sclerosis, kidney diseases including glomerulonephritis, chronic pyelonephritis, and interstitial nephritis. It's been useful in neurologic conditions, I'm not sure which ones, other than reflex sympathetic dystrophy. Finally, it's been helpful in fibromyalgia and rheumatoid arthritis. And that is the known published diseases that are benefited by ultraviolet blood.
So, doctor, is it something that people could use for preventive if they didn't have them?
Yes, there's a preventive aspect to ultraviolet blood, and it's principally the prevention of viral diseases and bacterial diseases to some extent. And I do have my so-called health nuts who come in here and probably once or twice a year take what they call a preventive ultraviolet. This is a low-level laser device. All you do is push the button and a pure laser comes out, and it's shined particularly upon muscles that are in spasm, and in just a minute or two it causes those muscles to relax. No medicines required. That's fantastic. So backaches, muscle pulls. It's also useful for tendinitis, bursitis, anything that pretty much ends in itis, which means there's inflammation. This turns off the inflammation.